My daughter that I've just had is my third child, and I felt like I was treated as though I already knew everything because I'd had children before. I was told that I was having a big baby. It was when I was asking questions about that I just didn't feel like, I was left really confused, basically.
When they'd ask questions or when they'd tell me something I wouldn't really understand,
I would have liked to happen was someone to reach out to me to say, look, your son is obviously not feeding properly. He's born via a C-section. You've obviously went through a lot of stress on the day. You were in labour for 72 hours. You know, is there anything that you would like to discuss? I didn't have that.
And so the other thing she said, when she didn't hear the baby moving, she went to book an appointment. She went to the walk-in center, Greta, yeah?
Yeah.
Yeah, and she was feeling very worried and very, very bad because she didn't know how to explain to them, and they didn't get for her interpreter.
And for me is language, because not speak English, and is very difficult for me for take it appointment in GP because not speak English and not have translator.
And because even Katerina or Sonila and Priscilla as well as me, like it impacted a lot our emotion.
pretty much impossible to develop any type of relationships with the consultants because it was a different one every time. But I did feel comfortable enough with her to text her those questions every once in a while. We didn't always get to speak on the phone because she wasn't always accessible. But yeah, there was pretty much no relationship with any of the practitioners.
Do you just feel like no one reads your notes before they meet you or talk to you? After the miscarriage, they hadn't taken me off the system, despite the fact I told them on several different times that the pregnancy had obviously not ended. And I kept on getting texts and calls and reminders about scans and things.
Pregnant women as we come in and, you know, asking how we are, but just turning your attention to us so that you're showing that you care. I do think COVID played a part, but I feel like there could have been a bit more communication and a bit more compassion.
I just lost a lot of trust, confidence in them. Like, they weren't telling me the truth half the time. They betrayed me. So, and regarding to all this, because there was the lack of support from them, it's made me and Richard lose our son because
nobody was really reassuring me on actually everything could go okay and everything could be normal and I could still have the birth that I wanted. It was more focused on, no, you're having a big baby. The other two babies you've had before were small, so this one's going to be completely different. And it just left me really scared, really low. I didn't look forward to the birth at all.
It feels coercive, it feels manipulative a lot of the time, and the fact that they're not listening to you, they don't respect your choices.
I felt let down by the service that I was getting because I was just like, you're meant to be there to be able to help me, and I didn't feel like I was getting the help or the answers that I wanted.
During my pregnancy, I had like starting everyday bleeding, and I need to call like midwife every day. She give me some what to say, stay in the bed doing like this, but not her call me. I always need to call her, and was very, very worried. I was like, don't know what to do.
I remember that anaesthetist was called Shay because he was so kind and so nice to me, and he came and visited me every day. It makes a huge difference. I haven't made any complaints. I don't get angry about it now because he was so kind to me, and mistakes are made. And I think if everyone goes into things with empathy and understanding, and you might see 20, 30, 40 births a day, but it could be that person's first ever birth, you know, and people are scared. And just to have a bit of kindness, to me, it made the world a difference.